बता दें प्लीज, अगर नहीं करना तो मैं अपना कैमरा ऑफ कर देती हूँ।
We are live now, Dr. Umar, recording पे on it.
अस्सलाम वालेकुम सर, कैसे हैं आप? ठीक हैं?
वालेकुम सलाम, ठीक है, आप कैसे हैं?
अस्सलाम वालेकुम अस्मा, कैसी हैं आप? सही हैं?
अल्हम्दुलिल्लाह नाज़ी जी, आप कैसी हैं?
मैं अच्छी हूँ, आप बताएं।
अल्हम्दुलिल्लाह।
Just give us few more minutes, क्योंकि हमारे काफी सारी रजिस्ट्रेशन है, देखें कितने लोग ज्वाइन करते हैं। आई थिंक जवेरिया शी जॉइंड, इज अमरीना ने ज्वाइन करना है?
पता नहीं सर, मेरी बात नहीं हुई उनसे,
अच्छा ठीक है,
मैसेज करके देख लेती हूँ।
so give us few minutes and then we'll make a start inshallah.
ओके।
आपको स्क्रीन नजर आ रही है मेरी?
सर नजर आ रही।
ठीक। I think nobody else is there at the moment. So let's make a start. Thank you so much for joining. So we are here in the first half. I'm going to talk about the nurse's career in the UK and everything they must know. In the second half, Dr. Omar, our academic lead, he's going to talk about the OSCE. The OSCE, what exactly it is and how the 5-day face-to-face course OSCE, what we'll be going to do, all the schedules and training for the nurses who want to come to the UK. Right, so who we are, Hive Medical Academy, we are the company with the decades of experience who are supporting international doctors, nurses, pharmacists, and dentists. We have been in the UK for more than 2 decades supporting international doctors. for the nursing journey. All right, so most important things about the nurses, the first step, they must have the degree at the recognized university. After that, first step is OET and then CBT and OSCE. OET and CBT they can take in their country, but OSCE they only can take in the UK. There are 5 centers in the UK, 5 universities, they conduct the OET, CBT, OSCE exam. There are the 10 steps which I try to summarize it, that anybody who wants to come to the UK, there are 10 steps, they can do it. First, again, you said that, if they need the sport, they register with Hive Medical Academy. We will help you to pass your OET exam. OET score is 350 plus, you need to score it. Then checking the eligibility criteria is on an NMC website. This is free. You don't need to pay anything on NMC website. Create your account and print out your eligibility criteria. After the CBT preparation, you must prepare for the CBT. It takes 1 to 2 months of wearing, sometimes maximum 3 months. You can prepare it well about the CBT, and then prepare all your documentation, supporting documents which you need, including for your OSCE and for the visa application. You need to submit all the evidence, and then I would say, book your OSCE exam, get your visa, come to the UK. In our view of the journey and what documents you need. So you need the degree or the diploma. Some countries the nursing degree is called the diploma as well. Then your English test, go to the NMC website, create your account, upload your documents, get your verify your identity, then prepare for book your CBT, prepare for CBT. Right after that, you have to book. There are 2 options here. Some of the nurses who have passed OET and before getting OSCE, they could start applying for the job of healthcare assistant. And if they get the course, that's the sponsorship letter, they could come to the UK, they could get the job in the UK, and they can work as a healthcare assistant for up to 24 months. And during that time period, they have to complete and pass their CBT and OSCE, and they will be promoted to Band 5 nursing after getting the registration. If not, the other route is step by step. First, you do OET, you do CBT and OSCE. For OSCE, you will get a 6 months visa, and you'll be in the UK. You pass your OSCE, apply for your NMC registration. You got the NMC registration, and start working in the NHS. Visa documents required. Obviously, you need the valid passport, TB certificate if required if you're in the country. Documents if you are dependent, your sponsor, somebody is sponsoring your funding and everything. You need a letter from them. Financial evidence, if request is police certificate, only where applicable under the UK immigration rules, and biometric. Right, for the OSCE, there's again a list of the documents. Your original passport, NMC booking confirmation, original qualification, your degree registration, your NMC, your country, relevant countries, nursing registration council document. Name change, if you have got it, you need the evidence that your name was changed. Most important thing, which was the most of the people were confused about, the police clearance certificate. According to NMC, you need the police clearance certificate from every country where you lived more than 12 months. Right? So if you lived 12 months in one country, 12 months in another country, if you have got 4 countries where you stayed more than 12 months, so you would need from each country police clearance certificate. If you lived less than 12 months, then you only need the police clearance certificate from your current resident country. But further, I would recommend strongly all the nurses that they must drop an email about their circumstances, that we lived in this country this months and now we are here. So would it be okay to give the just one certificate, or do we have to give all the certificates? Because it's a hassle to collecting. If somebody moved to 3-4 countries and they are not in that country anymore, it will be a hassle to get the clearance certificate. So draft an email that we left that country more than 2 years. Now we are here in this country for almost 15 months or 18 months. Do we still need to get the clearance certificate from the previous country, which is very hard to get in touch? We don't know anybody, so we advise them. So NMC at times could be very flexible. They say, okay, yeah, you are more than 12 months in this country, so provide only the current certificate. So I would strongly recommend that, before worrying about it, that we need to get the certificate from every country, better you just drop an email and you will have some evidence. That will be easy and helpful. So these are the documents list you need for your journey, nothing else. and easily you can go on the NMC website and you can check all these things. The most important thing I want to mention about the benefits of working, all the nurses who want to come to the UK, right? They must know about benefits of working in the UK or in NHS. NHS is the largest employer of the world and supporting doctors, nurses, healthcare assistants. So you get the paid leave up to 40 days. Everything is paid. You want to buy a new house, you want to buy a new car, anything, your NHS will support you for the getting loan. You have got option, either you want to go whatever specialty you want to go. You want to go into primary care, secondary care, you want to work in community only, district nurses. You have got complete option. Again, you have got option, either you want to do part-time, full-time, or you want to, just locum. So you have got all options, you have got in control. Lots of things, you get the discounts on almost everything for the NHS, being employed with the NHS. You have also apprenticeship schemes for your children, yourself. Your study courses, any course you want to do it, NHS will pay. Your study leave will be paid by the NHS. Courses be paid. NHS pension is one of the best pension scheme. On top of it, financial stability, security, training, and you have got the nurses. They have got the option to grow in their career. If they're starting from the band 5, they could go up to the band 8. And if they want to specialize, like if they want to go into one specialty, like want to go into palliative, geriatric, or they want to go in like cardiology, they have got the options. They could do the further career courses, like they become the nurse practitioner, where they work as along with the doctors. After that, if you want to become the advanced nurse practitioner, that's again 2-year course with educational supervisor, clinical supervisor, and then you will be working that sort of advanced nurse practitioner is equal to junior doctor. If you want to further grow in your career, you can become band 8, which is the nurse consultant, like specialist nurse consultant. That's the band 8, and that's the highest position in the nursing. You will be equal to medical consultant. You will be seeing the patients independently, running clinic, running wards. So sort of you would be consultant. So lots of options of the growth in the nursing career in the UK and NHS. How we do it, we always try to support, and if any nurse anywhere in the world, if they want to come to the UK, they're very easy, simple. Go on our website, get to register with us, and we'll take you step by step from your country, transition from your home to the UK NHS system. We will guide you, support you. We will provide you unlimited access for everything. The aim is just to make sure that you have got the proper professional guidance and you just focus on your studies, and we'll do rest everything for you. From your day one, supporting you from passing OET until you get the job, we'll do everything. Your CV, your portfolio, your airport pickup, your traveling, your accommodation, visa documentation help. We will support you step by step, everything. So that's mainly, so very simple, very straightforward. If you're a nurse anywhere, straight away go to the NMC website, check you're eligible for the nursing career in the UK. Second, after that, OET, we will help you in passing OET. After that, CBT will help you, OSCE will help you. Simple 3-4 steps, do it and come to the UK. You can easily start your career in the UK. And then plenty of support and growth is available, here in the UK. So we'll take the questions at the end. I will pass over to Dr. Umar now, so that he could talk about OSCE, which will be a bit detailed presentation.
Yes, thank you, Dr. Skill. Good afternoon, everybody. Just give me 1 second while I just sort something out on the presentation. I'll just be a few seconds. Overall, and how Hive can help. Hopefully I'll fill in some parts with a bit more detail, specifically focusing on the OSCE, but also I'll mention CBT as well. Okay, so let me just make sure I can share. Okay, Dr. Skill, are you able to see the
we could see
presentation? Okay.
Yes, it's
Excellent.
great.
Okay, so we already know who we are, so I'm going to skip that. I'm just going to quickly, briefly mention just the opportunity that this career presents for you in the UK. There are many, many tens of thousands of vacancies, nursing vacancies across the NHS in England. The figures vary depending on where you look, but they are certainly around this amount that you see on the screen here, 27 to 30,000. And the NHS is actively recruiting. Internationally trained nurses play a huge role in delivering nursing services in the UK. Currently over 30% of nurses on the nurse register are internationally educated. So international nurses are already a huge part of NHS care delivery and will continue to be so. Okay. Dr. Skills already mentioned that you need obviously eligibility, you need your English test, followed by CBT, and then after that, obviously there's OSCE, and actually some of these things can be flipped back and forward, and sometimes you might get an interview and you might get a job offer with a certificate of sponsorship before you even have completed your OSCE. So it can vary a little bit, but there are a few main steps that you need to go through. In terms of the total journey, around 12 months in total. Can be a little bit longer, but at least 12 months, and that includes the whole journey, including starting from the English test all the way to even completing relocation. Okay, so the CBT, which is a computer-based test, is part of what is called the test of competence for nurses, the first part. Although you can actually do them in, you don't have to do them in a particular order, but usually most people will do the CBT first because they can do it internationally, they can do it in their own country. And then the OSCE, they will usually do second because you have to physically attend in the UK to attempt the OSCE. So the CBT is a multiple choice test. There's 115 questions in total. So there's part A, which is focused on numeracy and calculations, and then part B, which is clinical knowledge. And they are all, both these sections are mapped to the NMC standards, or what we call the NMC code. And it is actually knowledge you already have, but you need to prepare in the right way to be able to pass the CBT. And we have Nazia on the meeting here, who's already passed her CBT, having prepared with us, so she's done very, very well. Nazia, do you want to share any kind of reflections or your experience of the CBT, or kind of give people an idea of maybe some encouragement of that how straightforward it is?
Doing great. Yeah, definitely. I will share my experience with you all guys. As Sir said, that there are two parts, part A and part B. Exactly same the exam was that. So part A was numeracy and part C was all about the practical. And the material which provided by the sir, that was very helpful for me. Most question was from that side. So I cracked it easily with the help of you all guys. Thank you so much.
Thank you, Nazia. No, I remember doing one of the teaching sessions, and Nazia already knew most of the things that we were discussing, so she was very well prepared. So she did very well in the CBT, and she's now going to be doing her OSCE soon. So that is the CBT. I'm going to skip the things about interview and visa relocation because they can sometimes, as I said, they can sometimes happen first, and then people come with an offer and then they attempt the OSCE. But I don't want to confuse people, so we'll just stick to the main steps that you need to think about. Now, the OSCE is a practical exam. And as Dr. Skeel mentioned, it's at an NMC test center. There are several around the UK. And there are a few different types of stations that you will have to clear in order to pass the OSCE, and we'll discuss that in a bit more detail now. So in terms of the purpose of it, why is there an OSCE in the first place? It's because it will come, it shows the NMC that you are safe and competent to practice as a nurse in the UK. So that's the reason why it is there. How is the OSCE tested or performed? It's a hands-on examination in a simulated ward at an NMC approved UK test center. So the closest one to us is Leeds, which is about 40 minutes by car or a short train ride away. So that one is quite close to us. And there are trained actors, and there are mannequins, and there are lots of things that you will have to face in the OSCE examination. So what are the stations like? So there are 10 stations in total, and there are 3 different groups of stations. The particular details I'll leave because I have some better slides explaining them. It's a timed examination, obviously, like all other OSCEs. It will take about 3 hours in total. I forgot to mention that the CBT is also 3 hours. The OSCE takes about 3 hours, and each station can be either 10 minutes or 20 minutes, depending on what type of station it is. And how are you assessed? Obviously, there's an assessment criteria based on the NMC standards, and each station is scored on its own checklist. So you can either pass or fail each station, and you must pass a minimum number of stations with no what are called critical safety fails, which we'll discuss briefly in a second. Okay, so we've already mentioned 10 stations, about 3 hours. The pass rate first time is unfortunately a bit on the low side. Can vary to roughly around about 50%, which is understandable to an extent, particularly if people haven't prepared properly. It can be quite a different exam to what you are used to, but obviously the right preparation will increase your likelihood of a first time pass greatly. Okay, so there are 4 what are called APIE stations. Hopefully at least some of you will already be aware, or maybe all of you are already aware what APIE is. So it's assessment, planning, implementation, and evaluation, where there is one patient scenario, and it runs through these 4 stages of assessing and providing and evaluating nursing care. You then have 4 stations that are clinical stations. So this can be practical skills, like taking observations, administering medication, demonstrating wound care. These are some examples. And then you have 2 what are called silent stations, which are basically written stations, where there is no examiner at the bedside, but these look at things like professional values and behaviors and evidence-based practice, which once you start preparing for the CBT will become more familiar to you in terms of what kind of concepts and what kind of things these cover. So just some examples. So an assessment part of the APIE station would be to discuss with a patient and complete a structured assessment, maybe with some news to observations, or to complete a news to chart. Take some vitals and complete the documentation. Planning could be where you are putting together a patient-centered care plan. Implementation is the actual physical, practical part of a particular skill. So it could be administering medication, or it could be some other commonly done or commonly tested nursing skill. And evaluation is reviewing the progress of the patient and giving a structured handover using SBAR. Clinical skills before practical skills delivered at the bedside on mannequins. So, you know, thinking about some of the things we've already mentioned. So wound care, you know, dressings, or, you know, managing a catheter, or whatever other kind of practical skills you would normally be expected to be able to complete as part of routine nursing care. Professional values and evidence-based practice we've already mentioned. Written station judged against NMC code on ethics, accountability, and conduct. So what are examiners actually looking for? We've been doing OSCE examinations for quite a long time at Hive, and myself personally, I've been doing them for even longer. And so OSCE examinations across different healthcare disciplines, there are lots of similarities. The kind of things that are non-negotiable are patient safety. Okay, so if you get these kind of things wrong, then no amount of doing excellent in other parts of the station will actually save your station for you. So if you do something that puts the patient at risk of harm or results in actual harm, then that will be what is called a critical safety failure. Professionalism is another one. So this needs to be in line with what the NMC code expects of nurses at all times. So that is in relation to how you conduct yourself, how you speak to the patient, the fact that you don't, you know, the way you are, you know, you are tolerant of their opinions and their behaviors, you're not judgmental, you keep things confidential, etc., etc. There are many different kind of things that come into this. So these are the things that are, you know, you must do in every station without fail, and failing to do them will result in a failure of the station. So how do you actually, what other things are important for you to show? So communication. This is obviously your spoken communication as well as your non-verbal communication. So you need to be clear. Communication needs to be two-way, needs to be patient-centered, and it needs to be easily, you know, understandable and logical. Clinical reasoning, which you know, hopefully is a term that you're familiar with. If not, basically it's demonstrating to the examiner the reason behind you doing particular things. So why you would need to do a particular observation, why you need to escalate a situation. And you have to actually verbalize these things in OSCE examinations, because the examiners can't, they can't mark you based on your thoughts. They have to mark you based on what you do and what you say. And of course, documentation, which does come into some of the stations, into a lot of the stations as well. Your documentation needs to be accurate, timely, and of course, you need to make sure all the kind of basic things are complete in terms of time and date and signing and these kind of things. So everything comes back to these principles that you will become familiar with through the NMC code of being safe, effective, and patient-centered. So what kind of not to kind of focus on negative things too much, but we've mentioned about, you know, what kind of things would result in you know, that station being an automatic fail, or you doing something that you can't rescue afterwards, no matter how well the station is done. And this applies, you know, we spend lots and lots of time preparing doctors for their OSCE examinations as well, and these apply in the same way. So obviously basic things like failing to confirm identity, you know, it could be the wrong patient that you're doing, not checking a patient's allergy history, and potentially giving medications, medication administration being unsafe, so the wrong dose, the wrong route, and other things as well, like infection control. This is a huge one. This is a common experience for us when we're teaching OSCEs. People forget the very basics about maintaining hygiene, aseptic, non-touch technique, sharps disposal, etc. And of course, when you are faced with a potentially serious or worrying situation, not recognizing deterioration, and not escalating appropriately. These kind of things will unfortunately result in a station not going very well. Just a little bit on timing, because OSCEs do carry a time pressure whichever type of OSCE you do. And so, you know, actually being able to handle pressure, handle time pressure, and be able to do tasks in 20 minutes or in 10 minutes is extremely important. And of course, that can only be done with practice, with repeated practice, timed practice, and with feedback on how to kind of improve things. So 20-minute stations, the longer ones where you have APIE elements to them, as well as care plans. You know, you have to work methodically, make sure you're not missing out any key steps, and try to leave yourself a little bit of time, maybe a minute or so at the end, just to check back over things. The shorter clinical stations, 10-minute stations, obviously are more time pressured. But of course, these time limits are set because it is reasonably expected for you to be able to do these things in this time. So, you know, doing it, you know, having, for example, you know, administering an injection, or, you know, checking certain observations. The more you have practiced under time pressure, the higher your chance of actually managing your time well in the OSCE examination. And the main thing with these kind of things is to pace yourself correctly. So that 1 minute that you get outside the station, reading time, you need to use that to come up with a plan, to know what exactly you need to do in the station, and then you proceed in a nice paced fashion. You don't rush, and you take your time to ensure you cover all the steps, and that is the best way to handle kind of managing time in these stations. Okay, so how do we prepare you? What will our OSCE course you know, give you as a general overview? You will have station by station drills or practice, and many different types of the 10 stations that you might be expected to face, including the latest additions, because they do change all the time. You will be able to master the frameworks and the basics of nursing practice as it's delivered in the UK. So, you know, ABCD approach, News 2, smart care plans, SBAR, etc., and be able to you know, feel comfortable with them and about speaking around them. You will have mock OSCE examinations, which is one of the best ways to prepare you for the exam, to actually put you in an exam situation with a timed, you know, with time pressure, with exam-like stations assessed and marked in the way that your exam will be, with feedback afterwards. This is one of the best ways that you can prepare for your OSCE examination. And one of the main strengths of our courses, all of our courses, whichever healthcare professionals we train, is small group coaching. We don't small group coaching. We don't have huge groups. We don't have, large classrooms full of dozens of people. You have hands-on tutoring from people with real UK experience, with real examining experience, who can give you personalized feedback on your weak areas and how to improve them. And you will see a progression and an improvement over the number of days that you actually attend for a course. So this is linked to what we've just said. How do successful candidates prepare? They practice repeatedly until things become automatic. I've been training doctors for OSCEs for years, and I keep saying to them, every person who comes to see us, that you need to go into a station and you need to look like you've done this thing 1,000 times before. If you look like this is the first time, or that you've not really done this before, it creates a bad impression. If you go in looking confident, you know the steps, you know the sequences, you're not getting lost, and you look like you're in control, that goes a huge way to contributing to you passing that station. You have to practice against time pressure. You have to get feedback. In particular, feedback from people more experienced than you is more beneficial than feedback from your peers, because when you are all preparing for the same kind of thing, it's difficult to know, and when you don't have any knowledge of what the examiner is looking for, what the station actually wants from you, it's very difficult to give feedback to somebody. Mocks we've already mentioned, but going further than that is to actually reflect on your performance, to not be afraid to practice, to be watched, to be given feedback, and then to reflect and improve. And that's the best way to prepare for these kind of examinations. Just very briefly, common reasons why candidates fail. These are usually can be traced back to a handful of habits, a handful of performance habits that can be fixed. The vast majority of the time is not about knowledge in any kind of OSCE examination. It's about how you actually perform in the station and whether you complete the task in a way and to meet the objectives of the station, and to do it in a way that is clear, logical, and obviously safe, and the examiner can see what you're doing. So communication, if communication is rushed, it's unclear, or it's one way, how can an examiner mark you, clearly? Safety, we've already mentioned. I don't want to go over that again. That's obvious. You do something unsafe, you're going to struggle to pass that station. Time management is key. OSCEs are timed examinations. You have to be able to handle time pressure. And then in addition to that, documentation, we've mentioned as well already. Documentation needs to be comprehensive, clear, accurate, and timely. And of course, professional values. We've also mentioned that a few times, about understanding understanding consent, confidentiality, maintaining patients' dignity, etc. This one about missing rationale. Again, this is, from preparing people for OSCEs for many, many years, not explaining, not verbalizing what you're doing or why you are doing it can really harm you in an OSCE station. Because if it's not entirely obvious to the examiner, how will the examiner know what you are doing and why? So getting used to talking through a station, or at least certain parts of the station, is extremely important. Okay, so our 5-day course, what is the aim of the 5-day course? The one overarching aim, obviously, is to try to ensure a first-time pass and try to remove or reduce the reasons that usually result in people failing. And these are all of the kind of things we've mentioned already. So how do we kind of do that? We have a framework approach, structured approaches for you to use in every station. Structure is extremely important in timed OSCE examinations. Without structure, it's very difficult to perform well in an OSCE exam. Guided practice, so that's hands-on practice with real feedback from experienced clinicians and nurses. It's not just a course where you sit there and you listen to somebody lecturing for a few days. That's totally useless. Or a video or reading about it. OSCE examinations are not passed and cannot be passed without practical application of the knowledge and the skills that you need to show. And I've already mentioned the mock examinations and their importance. So very briefly, just I'll give you an overview of the 5 days. So on day 1, we look at frameworks, becoming familiar, competent with things like ABCDE, News 2, Pews, and also introducing things like clinical reasoning and the importance of safety. Day 2, we look at themes around safe nursing care, so as care plans, medication administration, numeracy, which is also important in OSCE examination, and avoiding critical fails. Day 3, although there will be practical and clinical skills you do on every day, but day 3, we do lots more of it. Aseptic non-touch technique, injections, wound care, urinalysis, blood glucose, and lots of new stations that are coming out all of the time. Day 4, we're looking at values and documentation. So these are focusing on the silent stations, professional values, evidence-based practice, documentation, time management. And then day 5 is a full mock OSCE examination where you will complete a timed examination in the same way as you will do your real OSCE, and then you will receive personalized feedback afterwards and feedback on your strengths and weaknesses and strategies for how to improve your performance. Okay, so I think obviously in terms of, we've already covered like, things like the journey. There's obviously another step after you do your OSCE where you need to, and Dr. Skills, mentioned that already, you need to have all your documents present, you need to verify your identity, and you need to show certain things. But the outcome is that you receive your PIN, which is your NMC PIN, which confirms you are registered and licensed to practice as a nurse in the UK, which is, of course, is the goal. The goal is actually to also help you secure a job, but of course the end process of all of this assessment is registration with the NMC. So that's all. I probably, hopefully I've given you some idea of what kind of things are important for the OSCE, how to approach these examinations, and also what kind of experience you will get doing a fully immersive face-to-face course with us. Thank you.
We're open for any questions, so please, go ahead. Anything you want to ask, we're here.
Sir, I have a question, please.
Yeah, sure.
You said these 5 days are enough for the preparation because these are the 10 stations. So it is like important for just for the 5 days, or within a day we will do the 2 stations. It will be going through like that, or daily basis it will be the different.
Yeah, so as I showed in one of the slides, it's a graded process to get you prepared for passing the OSCE. Obviously, that's the main outcome, and because we are, we're quite a personalized academy. What we actually do, of course, there's a particular kind of way of delivering this course that is standardized, But what we do with all our candidates across all the OSCE courses is, have discussions about their strengths and weaknesses, and we can then spend more and less time on particular things that you are concerned about. But yes, of course, there will be elements of theoretical knowledge that will cover things that you already know about. We whiz through and we spend more time on things that you are concerned about. And of course, practicing stations, getting hands-on, doing a variety of the different types of stations is of course a huge chunk of the course. So yeah, we'll be doing that across each day.
Yeah, thank
So
you, sir.
it will be quite intensive course, like,
Yeah.
9:30 you start, you're finishing around 6 o'clock every day. And we keep very minimal number in the batches, like 2, 3. So there is no place to hide. You will be working hard those 5 days. So all your NMC OSCE content, blueprint will be covered. So aim is to make sure you have got everything, you know everything, and you have practiced everything which you need to pass your exam. This is how we do.
Thank you, sir.
If this journey is paid or free? Right. Thank you. All right, sorry, who is Juveria? Yeah, Juveria, did you do your nursing free of cost in your college? Did you pay any fee to them? You can unmute yourself and you can say, you have to, obviously you have to pay your exam fee and everything. When you register with NMC, you need to pay your exam fee as well when you book your OSCE. So Jenny, you will get, all the guidance and everything sports you will get, according to NMC guidelines to make sure you pass your exam, you make your transition from your country, your healthcare system to UK very smooth and pleasant. That's what we do. Anybody else want to ask any questions? Some of the people, they joined quite late. So if you want to ask any questions, please, if you're not clear about your journey from your home to the UK NHS, just ask anything. We're here to answer your questions and or authentic information. We have got Rehanna as well. She joined. I think Rehanna, I spoke. Rehanna, have you got any questions? I believe you want to start soon your journey. We have Kashmaila. I think I have not spoken to her. And we have Gasima, we have Amrina, do you have any questions? We have Areen.
Yeah.
Areen, do you want to unmute yourself and want to say a few words about how you're going to support? She's part of our, Areen is, Dr. Areen is Hive ambassador as well. So Areen, do you want to turn your video on and want to say a few things?
Yeah, hello. It was nice to see you today. Yeah, as always, very short, concise, and knowledgeable experience with you. And I think so. All the nurses in a safe hands with you, and they would achieve their dreams and probably all their work in the NHS. This is what we're looking forward.
Okay, that's it. So when you guys
you.
come here for the OSCE, you will see Dr. Areen as well. She's part of our Hive team. And then we have Ms. Asma. She will do our closing if nobody has any question. Nazir, do you have any question?
No, sir. Thank you so much. You already cleared all the queries step by step. It's very knowledgeable for all of us. Definitely, we will come there and join OSCE soon and meet you all guys.
Yeah, definitely. Definitely.
Thank you.
Ms. Asma, it's over to you if you want to do the closing, and anybody has got further, they can contact you. Yeah, over to you if she's, Asma is there. Maybe Asma is
Maybe she's just away. Yeah.
All right.
Yeah. If you just close Dr. Gill, yeah.
Yeah, thank you so much, everyone. And we are always here. Any question, anything, just few things we want you guys to be in safe hand, because, I have come across few of the nurses, unfortunately, they went to, student consultant, they wasted so much money. You don't need to. Please, for the advice, just go on straight on NMC website. And if you don't understand anything, just give us a shout. Don't waste your money. Get simple 3 steps. You need your degree, you're a nurse, English test, CBT, OSCE, start your job. and we will help you in all these steps. Right, so we will see you soon, everyone, and get in touch if you have any questions. Thank you so much for joining today. Thank you.
Thank you,
much, sir.
everyone.
Thank you so much
Bye-bye.
for your precious
Thank
time.
you.
Thank you so
Thank
much.
you.
Thank you so
Thank
much.
you.
Bye.
Bye.
Bye.